process or phase or journey called IVF or infertility. Infertility is the inability to achieve conception, after having sex for 1 year, 2 years, 3 years. I know some of you have been trying for more than 2, 3, 4 years, and it has been a frustrating journey that's affected you in different areas. Personally, even some of you, it has affected your job. You're not productive. Some of you, your business is not moving because you have to focus on buying this drug, doing this IVF, and the rest. I cannot pretend as if I don't know that it's not easy. It is not easy. Some of you have done IVF more than once. Some of you are about to do IVF. Some of you had a failed IVF. Some of you had miscarriages. A lot of issues are going on, but you have to move. So I listed out some things that I feel will help in this journey called IVF, or in this journey called infertility, because everything is not about IVF. Some of you can get pregnant just naturally. I have couples that they had a failed IVF, and in the next month they got pregnant naturally. So what can you do in this period or in this phase of your life? I'll start by saying knowledge. Knowledge is power. Infertility is when you can't achieve pregnancy after having sex, unprotected sex, for more than 1 year. And the causes is simply because the sperm and the egg don't meet. So when they don't meet, because probably the sperm is not enough to get into the woman's body, into the woman's fallopian tube, or maybe the sperm gets there, but the woman is not ovulating, or maybe the woman is ovulating, the sperm also gets there, but there's a blockage, like tubal blockage. So you have to do some tests. They will check the sperm tests, check the sperm level if it's okay, sperm quality if it's okay. They will check the womb. They will do it by doing a pelvic scan. They will check the fallopian tubes by doing HSG if it's open or blocked. They will check your hormones for ladies. Your hormones that make you to ovulate. If you're ovulating well, sometimes you can go as far as checking AMH. That talks about the quality and quantity of your eggs. So with all this information, we should find the problem. And when we find a problem, then there should be a solution. So the type of treatment you need depends on the results, the test result that you have. For example, if you have blocked tubes, you can first of all try tubal flushing before you try IVF. Or sometimes you go straight to IVF. Or you may have an open tube, maybe you have PCOS. You can try natural means, like using some medications like Clomid, letrozole, and time your ovulation and have sex. Or you can do IUI, whereby they wash the sperm cells and transfer it into your womb when you're ovulating. So the cause of infertility will determine the type of treatment to take. So you have to have knowledge. You have to understand what is going on. Most people, when I talk to some people, they'll say they didn't find anything. There is something wrong. There's not like they didn't find anything. There is something wrong. They are doing there's only a test and some advanced tests you can do on the sperm. Because for me nowadays, I don't depend on sperm counts. I tell clients to do what they call sperm DNA fragmentation. That one talks about how genuine is this sperm good. It's a more advanced test. A man might have a good normal sperm count, but yet the sperm is not strong enough to fertilize an egg. A woman too can tell us to go and do AMH. A test that will prove the quality of her eggs. Sometimes it could be your lifestyle. Are you taking too much alcohol? Are you taking too much caffeine? Are you taking too much smoking? Are you eating on LD? Are you treating hypertension, diabetes, HIV, ulcer? All these drugs affect the fertility. So before you start any medication, always seek your doctor's consent or ask a fertility doctor. So you must understand the problem. That's number one. Knowledge is power. Once you know something, at least it gives you some level of peace. Number two is acceptance. The problem that we all have is that most of us don't want to accept the fact that we have a problem. God forbid I have PCOS. God forbid I have endometriosis. God forbid I have low sperm count. God forbid I have ovarian failure, menopause. God forbid my eggs are bad. Yes, God forbid, I agree with you. But what of if that is not the way for you to get pregnant? The reasons why some couples have waited 10, 15, 20 years is because of lack of knowledge and also lack of accepting the problem. A woman who has a big fibroid and has been drinking herbs for the past 10 years, believing that the fibroid will shrink, and nothing still happens, will you say she has been waiting for 10 years, or she or is lack of acceptance? Because fine, nobody wants to go under the knife. That's true. But you have to accept the problem. If you have fibroid that will disturb pregnancy or affect fertility, you need to accept it and you need to go for the surgery so that you improve your chances of getting pregnant. If IVF is your best option, you just have to accept the fact that you have to go for IVF. Don't go round and round the cycles and you spend money on millions on herbs, and at the end of the day, you still come out to do the IVF, whereby you spend millions. IVF is expensive, and there's no center that would want to do free IVF for you because they import a lot of things. So you have to accept the problem, the diagnosis. A saying says that peace of mind. Peace of mind is when you accept that you cannot control some things and you can control some things. There's some things that you can't control. For example, tomorrow, you don't know what will happen tomorrow. So peace is accepting what you cannot control. Another one is focusing on the solution and not the problem. Most of us focus on the problem a lot. We focus on why the egg is low. We focus on our husband not being cooperative, on our wife not being cooperative. We focus on other things that will not benefit our fertility, and this will raise your stress hormones. At the end of the day, you are having hormonal imbalance, you're having irregular menstruation, and the rest. Please focus on the solution. If your solution is to go and do tubal flushing, then focus on it. If your solution demands IVF, focus on it. If your solution demands IVF donor egg, focus on it. If your best option is surrogacy, focus on it. Do not